Here is your YouTube review for the first PowerPoint on the eye, focusing on the anatomy of the eye. This anatomy includes accessory structures, such as eyebrows and lids, the conjunctiva, your tear-making apparatus, and the extrinsic eye muscles. The conjunctiva was discussed in terms of the disease conjunctivitis, otherwise known as pink eye. When this membrane becomes infected, the membrane has a protective function. It comes down the inside of the eyelid and around the front towards the cornea. Another accessory structure, your lacrimal gland and ducts, which is your tear-making apparatus. It is located above the eye with the design for tears to wash across the eye and to drain into the duct and into the nasal cavity. You have 6 extrinsic eye muscles. There were 4 rectus muscles that you were asked to memorize. That would be the lateral rectus, which turns the eyeball laterally. Where's my medial rectus, which turns your eyeball medially, as if you were looking at something, a bug that landed on your nose. The inferior rectus, and of course the superior rectus. Those rectus muscles, those are extrinsic muscles, which are under conscious control and are considered skeletal muscles. The onion analogy, here's your 3 layers of your eyeball, from superficial to deep. The inside of the eye is filled with fluids, otherwise known as humors, again an aqueous in the front and the vitreous posteriorly. I would familiarize yourself with this diagram. There will be a diagram on the quiz. Structures you're responsible for include the ciliary body or muscle, the suspensory ligaments, the cornea, the iris, the pupil, the lens, Schlemm's canal, sclera choroid, retina, macula lutea, fovea centralis, optic nerve, optic disc, and what's not mentioned here, vitreous humor, aqueous humor, and that mostly covers it. The outer tunic, otherwise known as the fibrous tunic, is composed of the sclera posteriorly and anteriorly the cornea. So this is one continuous structure. The sclera functions in protection and as a anchor point for your rectus muscles, and we know what the cornea does. Laser surgery reshapes the cornea. The middle region is supplies blood and nutrition to the eye, otherwise known as the choroid region. Besides blood vessels in this region and some pigment, you find the ciliary muscle and the iris. So these are your smooth muscles. Your involuntary muscles are what was called intrinsic muscles on some of those worksheets we did. The sphincter pupillae and the dilator pupillae muscle. One under sympathetic and the other under parasympathetic control, both under the, of course, the autonomic nervous system. The inner layer is the sensory tunic, otherwise known as the retina. The important cells here are your photoreceptors, your rods, and your cones. Rods are more numerous than cones. They occupy the rear of the retina. Here the important term is the optic disc, which is considered a blind spot due to its not having any rods or cones at that area to allow for the exit of the optic nerve out the back of the eye. And that's visible here. I mentioned in a diagram, if there's a line pointing to the area on the retina, that would be the optic disc. If the leader line is pointing to behind the retina, that would, of course, would be the optic nerve. Spend some time on the contrasting rods and cones. And this breakdown here you should know. So on your retina you have mostly rods in the periphery. And then you have an area where you start to have some cones. That area is called a macula lutea. And then within that area you have an area that's all cones, which is your fovea centralis. Good luck.